And Mayor de Blasio is defending his decision to expand vaccine eligibility in the city.
This is health officials in New York and New Jersey try to remedy the disparity in distribution. CBS 2's Bauman has this.
New York City is expanding its vaccine eligibility to include taxi drivers, New Yorkers in developmentally disabled facilities, as well as restaurant workers, since indoor dining will resume later this month.
Indoor dining obviously involves people taking off their masks, eating, drinking, talking, laughing. There's a vulnerability there.
On Friday, Yankee Stadium will open as a vaccination mega site for Bronx residents only.
We need vaccine here, and the vaccine should be in the hands of the doctors of the community, who know their patients, who know their people.
That's what Governor Murphy says he plans to do in New Jersey.
We will be working directly with our communities of faith to turn houses of worship and other community gathering places into vaccination centers for local residents.
Just 5% of vaccine recipients in New Jersey are Hispanic or Latinx, and 3% are black, even though 15% of the state's population is black.
It has a lot to do with the history of systemic racism in the medical establishment.
Dr. Sharif El-Nahal is president and CEO of University Hospital in Newark.
Unless you go out there and, in particular, have people of color who represent your institutions, healthcare providers, leaders, etc., you really start to open that door of trust, and then you can start to debunk some of the myths and address concerns.
Dr. El-Nahal says supply is still the biggest limitation, not to mention none of the state's vaccination sites is located in an urban area. But some good news, as another vaccine may be nearing emergency use authorization. Researchers say the AstraZeneca vaccine appears to not only prevent people from getting severely ill from COVID, it may also slow the spread of it. The vaccine is already authorized in the UK, but experts caution more analysis is needed. Bauman, CBS 2 News.